Hi, I'm Dr. Joachim Sehrbrock. I'm a behavioral health consultant and also a registered psychologist. And in this brief tutorial, I will give you the information that you need to start referring patients to the Behavioral Health Consultation program. A behavioral health consultant, or BHC, is an integrated healthcare professional in your clinic. The BHC supports physicians through consultation and provides evidence-based services to patients with a goal of increasing service efficiency in primary care and access to quality mental health services. Consultations can be provided, for example, about mental health issues, life problems, stress, worry, and emotional concerns that in some way interfere with a person's daily life or overall health. The BHC sees up to 8 patients per day for roughly 30-minute appointments, up to 4 times over a period of a month or several months, depending on clinical need. The first session is typically a functional assessment, during which presenting issues are clarified, and the BHC develops a treatment plan with the patient based on the physician's referral. And then subsequent sessions focus on increasing functional outcomes. In addition to helping patients directly, the BHC also provides education and support to physicians through consultation about mental health or behavioral issues. Because the focus of behavioral consultations is primarily on functional outcomes rather than exclusively on symptom reduction, BHC can help patients with any condition that has an impact on their functioning. This would include mental health disorders like depression, anxiety, or panic, chronic diseases like diabetes, heart disease, or asthma, chronic pain, stress or somatization responses, and those may be stress-related physical complaints or psychogenic symptoms, as well as lifestyle changes like smoking or weight loss. So the primary goal for the BHC would be to increase the patient's functioning as efficiently as possible. And for many patients, this may mean teaching them strategies to better cope with their symptoms. For other patients, it may mean strategizing, for example, about medication compliance or helping them with relationship conflicts. Patients from any age group are welcome, so this could be a child struggling with behavioral issues at school or an elderly person experiencing symptoms of depression, and families and couples are also welcome. The BHC can then also consult with you, the physician, about complex cases. However, it is understood that the physician is the primary provider and case manager who takes responsibility, for example, for signing off on things like third-party liability, disability, WorkSafe BC, or ICBC claims. The decision about whether and when to refer a patient, of course, depends on your clinical judgment, as well as clinic factors such as the waitlist for the BHC. But the following questions may also help determine the appropriateness of referring to the BHC. So, for example, does the patient need help with any of the criteria mentioned in the previous slide? Is the patient willing and likely to benefit from BHC interventions? You can also use symptom severity or functional impairment ratings as a guide. So, for example, by asking 2 simple questions. 1, on a scale from 1 to 10, how intense are your symptoms? And 2, how much are your symptoms interfering with your day-to-day life? Part of the reason for using the term behavioral health is to lower the chance that a patient would feel stigmatized by having to associate in some way with a program that uses words like mental health, therapy, counseling, or psychology, or seeing a psychologist. So it's important to avoid these terms when you initially make the referral to increase the likelihood that the patient will take advantage of the service. Another key is to frame the behavioral health consultant program as a routine, legitimate part of primary care. If necessary, refer to the BHC staff as behavioral health consultant, but during the first appointment with the BHC will do an introduction to the program and the BHC role, which has carefully been crafted to reduce stigma. And then lastly, it's also important not to imply that the BHC services are long-term treatment or therapy. And this is another reason why we avoid terms like mental health or counselor, because patients may have preconceived notions about the length and intensity of the intervention. Once you determine that the patient is an appropriate referral to the BHC, here's one efficient way that we identify to facilitate a referral. The first step is what we call a segue, and this would include summarizing and validating the patient's concerns that you discussed in your consultation to set the stage for the BHC referral. You can then link the concerns that you discussed to the patient's psychosocial, overall health, or behavioral functioning, and then finally describe the BHC program in terms of learning new strategies or making appropriate life changes. So, for example, let's assume you identified a patient with depression to refer to the BHC. You could say something like this. It sounds like you're suffering from some troublesome thoughts and feelings that seem to affect your sense of life satisfaction and well-being, and these are very important and very basic aspects of your overall health. Many of my patients have found it useful to get assistance in learning new strategies to deal with these barriers to their overall health. The second step is an introduction to the service, and you could say something like this. I have a colleague, Dr. Sehrbrock, here in the office who works very closely with me on the types of problems we've been discussing. I'm wondering if you would like me to introduce you to him or to schedule an appointment with him. He will meet with you for about 15 to 30 minutes and talk with you more in depth about this aspect of your health care. Then he will go back to me and we will use the information the two of you come up with to create a set of strategies that will allow you to be more successful in tackling the problems we've talked about. The third step of the referral process has two alternative options. Option A applies if the BHC is in the clinic on the day you talk with the patient about the referral. In that case, we recommend you ask whether you can introduce the patient to the BHC directly. We refer to this as a warm handoff. We feel that the referral may actually be more successful if the patient has briefly met the BHC before the first appointment. If the BHC is in session, don't worry about interrupting. Just ask the BHC whether he can step out for a second. Behavioral health consultations are different than therapy, and because patients are used to interruptions in primary care, it seems more important that a potential new patient can meet the BHC than to interrupt a session. Option B applies if the BHC is not in the clinic or the patient says no to being introduced, in which case you can ask the patient to schedule an appointment at the front desk. And then finally, a referral to the BHC doesn't require you to fill out any extra forms. You can just make a note in the patient's record with ideally the following information for the BHC to review for the first appointment. What specific symptoms are interfering with what areas of the patient's functioning? For example, this might be a brief description about symptoms of anxiety and the way that anxiety may interfere with a patient's functioning. You may also add any relevant history about the issue and any relevant psychosocial factors. This could include information about factors you think might play a role in exacerbating the patient's symptoms. So, for example, if the patient has recently broken up with a partner and this may be related to the patient's anxiety in your mind, then this might be helpful for the BHC to know and to read about. And then finally, you can also include any questions you might have for the BHC. For example, you might be interested in the BHC's diagnostic impression, or perhaps you want to know how to best address the patient's anxiety in a follow-up appointment. The BHC always welcomes brief in-person consults about the referral as well. So in addition to writing something in the EMR, you might also consider just talking to the BHC directly, briefly about the referral. How the BHC collaborates with you depends completely on your preferences. Let the BHC know what type of feedback you wish about a patient after an appointment with the BHC. This could be a concise 30-second verbal summary from the BHC in the hallway about the patient's plan and the BHC's impression. It could be a consult at the end of your day, or it could be same-day clinical notes in the patient's record. In order to maximize service efficiency and also access to the BHC, in many integrated clinics, patient contact is alternated. That means after the BHC sees the patient, the next session could be with a physician who could discuss and follow up on the BHC's recommendations and treatment plan. And then the BHC could see the patient again for follow-up, etc. We call this leapfrogging. I already mentioned the warm handoff or brief introduction of the patient to the BHC if the BHC is in the clinic on the day when the physician talks with the patient about the referral. Consider the BHC's door always open. If you have any questions, please don't hesitate to contact me, and I very much look forward to working with you.